Dry eye illness is characterized by a lack of tears, either in number or quality. Confronting the irritation caused by dry eyes can feel like a constant uphill battle, and the disease has the potential to impair your vision. It is possible that you have dry eye syndrome if your eyes itch and burn, seem red, or feel gritty, as if there is some sand lodged in them. This disease can occur if the minute glands that are located in and around your eyelids do not produce enough tears to maintain the health of your eyes and ensure that you have clear vision. When they function properly, tears keep the surface of the eye clean, pleasant, and well hydrated. They also wash away dirt and debris, which helps to prevent infection, and they shield the eye from foreign bodies. Tears are constantly being produced by healthy eyes as a means of maintaining their moisture levels. On the other hand, there are several disorders, drugs, and even the natural process of aging that might cause your eyes to produce fewer tears. Dry eye can also occur if your eyes don't produce enough of the correct kind of tears, which are necessary to flush out particles and maintain a well lubricated surface. What you do to make your baby blues, browns, or greens more comfortable relies on what's causing your dry eyes in the first place. Baby blues, browns, and greens all have similar causes. The illness is characterized by a wide variety of symptoms, including the following: dry eyes, redness, itchy, watery eyes, vision that is not clear, the sensitivity to light, eyes that are itchy or irritated. There are many different things that could cause dry eyes, such as allergies, medical disorders, or even overuse of computers. Having knowledge of the root cause can be beneficial, especially if it's a disease that can be treated or an environmental element that can be eliminated. On the other hand, if you aren't a master detective, focusing on managing your symptoms can sometimes make the difference between having another bad day and having a day where your eyes don't feel dry. Therefore, here is a list of 10 home remedies that can help relieve dry eye symptoms. But first, subscribe to our channel for more amazing content. Let's dive in. Number 10. Eye drops. You might benefit from using artificial tears if your natural tear production is insufficient. Lubricating eye drops that are available over the counter can help support your natural tear film, which in turn helps protect the surface of your eye. Many brands of eye drops include preservatives, which prevent potentially hazardous bacteria from growing in the medicine after it has been opened. Unfortunately, although it does not happen very often, some people's eyes can have an adverse reaction to the preservatives, resulting in inflammation and dryness of the eyes. Consult your optometrist about switching to eye drops that do not include preservatives if your current eye drops appear to be the cause of dry eye or an increase in symptoms. Number 9. Limit screen time. Dry eyes is one of the symptoms of digital eye strain that occurs most frequently. The normal human blinks 12 times each minute, while those of us who work at computers only blink 5 times per minute. Because of this, our eyes are more likely to become dry. We are more likely to experience eye strain, acquire headaches, and feel irritated when we do this. Taking frequent breaks from our displays allows our eyes the opportunity to relax after being forced to concentrate on digital devices. It is advisable to follow the 20-20-20 rule, which recommends giving your eyes space and time away from screens every 20 minutes. Number 8. Heated compression. Applying a warm compress can be an effective treatment for the symptoms of a variety of eye disorders. For instance, discomfort or inflammation brought on by dry eyes can be alleviated by heat. Additionally, it might also activate the meibomian gland, which would result in increased tear production. In addition to this, it gives you the opportunity to rest your eyes by simply shutting them for a moment. Number 7. Massage. A soothing massage to the eyes has several beneficial effects. A little bit of self-care and attention can go a long way toward reducing stress, enhancing blood flow, and relaxing muscles. Even though you are not actually touching your eye, touching the areas that surround your eye might have an effect on the sensation of your eye and may cause you to produce more tears. It should never be painful no matter how you choose to massage the region around your eyes. If you don't have any prior experience with massage or acupuncture procedures, it's in your best interest to get some expert advice first. Number 6. Clean eyes. It is crucial to your eye health to clean your eyelids, eyelashes, and the region around your eyes on a regular basis. It is possible that this will prevent the buildup of germs, which is one of the factors that might lead to eye disorders or diseases, such as blepharitis. Blepharitis is an inflammation of the eyelids that can be brought on by blocked oil glands that are located beneath the eyelashes. Blepharitis is a condition that can be avoided but cannot be cured once it is set in. It has the potential to irritate the eyes and make them red, dry, or even burn. Cleaning your eyes regularly is vital for maintaining unclogged oil glands and producing an adequate amount of tears. If you think you could have blepharitis, you ought to make an appointment with your optometrist so that you can go over the available treatment choices. Number 5. Better sleep. Getting enough rest, both mentally and physically, requires you to get enough sleep. It is the only time that your eyes will remain closed for a significant amount of time, providing them with protection and rest. A restful night's sleep is beneficial to several of our body's processes, including stress repair, memory, vitality of the heart, metabolism, energy levels, cognitive skills, immune system, inflammation. Because inflammation is controlled by sleep, getting enough of it is essential if your dry eyes are caused by an immunological issue. The optimal amount of sleep varies according on a person's age as well as their overall health. To combat a cold, for instance, you might require additional rest. The average amount of sleep that adults need is between 7 and 9 hours. As people get older, their demand for sleep gradually decreases. On the other hand, younger children and adolescents require significantly more sleep. Number 4. Drink water. Even though water isn't the sole component that makes up tears, it is by far the most crucial. A tear is mostly composed of water, 98%, along with 2% oil, salt, and more than 500 proteins. Therefore, your tear production will get drier if you do not consume an enough amount of water. You may have heard that individuals should consume 6 to 8 250 milliliters, 8 fluid ounces, glasses of water each and every day. It is a good guideline, but it shouldn't be taken as an absolute recommendation for everyone. The amount of water you require is determined by factors such as your activity level, health, and the surroundings. If you aren't sure how much water is ideal for you, a good rule of thumb is to drink 6 to 8 glasses per day. The next step is to discuss hydration and your overall health with your primary care physician. In the foreground is a couch that is somewhat out of focus, and in the background is a white humidifier that is perched on a small stand. Number 3. Humidifier. It's possible that the dry air in the room is making your eyes feel uncomfortable. Using a humidifier, which provides moisture to the air and can alleviate symptoms of dryness, is recommended. Additionally, humidifiers are able to alleviate additional health problems that are associated with dryness. Dry skin, coughing up dry mucus, nose irritation, pain in the head and throat, pressure in the sinuses. If you have other symptoms of dryness, using a humidifier in the proper manner can be an alternative that can come in handy. Number 2. Omega-3 fatty acid. If you consume fish oil regularly, you will have a 17% lower chance of developing dry eye syndrome. In addition, omega-3 fatty acids, which are frequently discovered in fish oil, can assist your eye health by reducing the severity of symptoms and enhancing the quality of your tears. You can get a natural dosage of omega-3 fatty acids by eating fish, but another alternative is to take a supplement instead. Number 1. Eyewear. The use of eyewear, such as sunglasses or sports goggles, is a beneficial practice for the protection of one's eyes. In addition to this, it will prevent irritants or particles from exacerbating your already dry eyes. Wearing sunglasses will prevent sun damage to your eyes. Sunglasses have the same effect as dimming the light. It is possible to have dry eyes if you have photophobia, which means that your eyes are overly sensitive to light. Wearing protective eyewear places a barrier between your eyes and potentially inflammatory elements of the surrounding environment, such as dirt, wind, and chemical irritants, perfumes, cleaning products, etc. When experiencing symptoms of dry eye, it can be good to have some home treatments on hand. But if you notice that your symptoms are getting worse, or if you're ready to try an alternate treatment, your optometrist can help you identify other possibilities. Dry eyes not only cause discomfort but also have the potential to foreshadow the development of other eye disorders. So, what do you think of these remedies? Share with us in the comments and join our YouTube channel by clicking the subscribe button.